So this video is one video in a series of videos that will discuss how to care for a patient using the CareFusion REVEL ventilator. In this video we're going to discuss non-invasive positive pressure ventilations, indications, apnea alarms, and how to apply non-invasive positive pressure ventilation to a patient. The REVEL ventilator is able to supply both BPAP and CPAP plus pressure support. CPAP is a non-invasive mode of ventilation that provides continuous positive airway pressure throughout the ventilator cycle. Think of CPAP as PEEP. CPAP is indicated to reduce shunting, decrease preload, and recruit alveoli. The main indication to use CPAP is somebody with a hypoxic respiratory disease. I normally think of using CPAP in somebody with congestive heart failure. BPAP has two distinct pressures associated with it, IPAP and EPAP. Think of EPAP like CPAP or PEEP. Again, the reason that we use EPAP is to recruit alveoli, decrease preload, and reduce shunting. IPAP, on the other hand, is a driving force, and it's used to reduce PaCO2 or decrease PaCO2. BPAP would be used in a patient who's got a hypoxic and a hypercapnic respiratory disease or a hypercapnic respiratory disease. When using the REVEL to do non-invasive positive pressure ventilation, you must attach the ventilator circuit to a face mask or a nasal mask. Only masks specifically labeled or intended for non-invasive ventilation should be employed on the REVEL ventilator. Masks should not have any valves or leak vents. It is important to note that a good mask seal with the patient's face should be achieved. Excessive leakage will adversely affect exhaled volume measurement accuracy. Minor movement in the patient will increase those leaks. One of the things that you can do to help alleviate some leaks is to increase your bias flow. So, how do we employ CPAP plus pressure support or BPAP on our patient? The first thing that we need to do is, again, get a good seal with a mask on our patient face. Okay, so now what we're going to do is hook a patient up using non-invasive positive pressure ventilation, CPAP, and then CPAP plus pressure support. So a couple of things to note when using CPAP and CPAP plus pressure support is that I can provide oxygen to my patient via a high pressure hose, or I can use an oxygen supply tubing and a Christmas tree in the low pressure setting if I choose to do that. If I choose to use the low pressure setting, the ventilator will entrain atmospheric air to help me run my turbine, which may be advantageous in some people. It doesn't matter if I use the low pressure system or the high pressure system. I have to use a mask that is non-vented for this ventilator to be effective. So let's go ahead and place a pressure on CPAP. So I'm going to go ahead and turn the ventilator on just like I normally would. I'm going to go ahead and silence a couple of alarms here real quick. I'm going to choose to use a new patient. So I'm going to rotate it to new patient, select it. Not worried about patient ID. I'm going to choose an adult patient, although I could use CPAP and CPAP plus pressure support and BPAP on a pediatric or a neonate if I wished. But for the example, I'm going to use an adult. I'm going to go ahead and select that. I'm not going to choose intubated. Instead, I'm going to choose non-invasive positive pressure ventilation. I'm going to select that. When I select that, it gives me a menu to adjust my inspiratory positive airway pressure. I don't want to do that because I'm choosing to use CPAP and or CPAP plus pressure support. So I'm going to go ahead and select my IPAP and dial that down to the lowest level, which will be 6. You'll notice that it's blinking right here. Pressure support plus PEEP is my inspiratory positive airway pressure. So 6 plus 0 is 6, and that's okay. So I'm going to go ahead and be okay with that. The next thing that I'm going to do is adjust my EPAP. My EPAP currently is at 6, and I think I'm all right with that. Remember, EPAP is the same as CPAP, which is the same, roughly the same as PEEP. I'm using that to recruit alveoli, decrease my preload, and reduce shunting. So I'm okay with that now, but I'm going to select a little bit higher here in a second. I'm going to rotate, and I see my rate is 12 at this time. 12 is not the ventilatory rate I'm going to provide. That's going to be the backup rate that I'm in when I'm in CPAP plus pressure support, or CPAP. So the REVEL ventilator has an apnea alarm in it. That apnea alarm will be triggered after 20 seconds of a no ventilatory effort by the patient, and it'll default right now to 12 breaths per minute. I could choose to increase that to 14 or 16 or whatever I wish to do. For the example, I'm going to leave it at 12 breaths per minute. I'm going to rotate my next one, and it's going to be ventilate. So now I'm ventilating my patient. Allow me to silence some alarms so I can monitor my patient versus the alarm. So I'm going to silence, and I'm going to dash out my low pressure alarm, and I'm also silencing or dashing out my low minute volume alarm. Now you'll notice a few things about the ventilator. Currently, I'm in a non-invasive mode of ventilation, NPPV. My patient doesn't have any effort. I'm supplying oxygen at 21%. My rate is 12. My I time is 1. I'm currently ventilating a patient with a pressure control of 1 with a PEEP of 6 right there. That is not what I aim to do. My aim is to provide continuous positive airway pressure. So what I choose to do is go ahead and go to breath mode. I'm going to push that, and I'm going to dial it down to CPAP plus pressure support and push it. Now currently what I'm doing is I'm allowing my patient to breathe on their own. You can see some spontaneous efforts when that light illuminates right there. And I'm supplying them with 6 of CPAP. Remember, CPAP would be indicated in somebody with a hypoxic respiratory disease. Now maybe I want a little driving force with my CPAP also. I want to provide some pressure support with it. So in that case, I'm going to do CPAP plus pressure support. Right now I'm only in CPAP, and I'm going to give him some pressure support. So maybe I dial that up to 10. So there you go. There is CPAP plus pressure support and CPAP. Of course, I can adjust my CPAP or my PEEP to drive that fluid out of the alveoli and reduce shunting and produce hypoxia. So maybe my patient benefits from a higher CPAP. I know traditionally in the field and in the ambulances and stuff, we usually provide a CPAP of at least 10 centimeters of water. You guys, that is CPAP and CPAP plus pressure support. If you have any questions, please feel free to reach out to me. Also, there is a more detailed description of CPAP and CPAP plus pressure support and BPAP in the lecture that is provided on the AirLink 2/Lifeline1 YouTube page. You can also find information about CPAP, BPAP, and CPAP plus pressure support in the CareFusion REVEL ventilator manual on page 4-12. Alright, in the last video we discussed CPAP and CPAP plus pressure support and how to apply that to a patient. In this video we're going to discuss how to apply BPAP, or otherwise known as BiPAP or bi-level positive airway pressure. So remember that CPAP doesn't do anything to change the mechanics of ventilation. It's just a continuous positive airway pressure supplied throughout the ventilatory effort, both inspiratory and expiratory. BPAP, on the other hand, has 2 distinct pressures, both an inspiratory positive airway pressure and an expiratory positive airway pressure. Please think of EPAP as CPAP or as PEEP. Its job is to recruit alveoli, decrease preload, and reduce shunting. IPAP, on the other hand, is used to drive and to decrease my PaCO2. CPAP should be indicated in somebody with a hypoxic respiratory disease, and BPAP should be indicated in a patient with a hypercapnic respiratory disease or a mixed hypercapnic/hypoxic respiratory disease. So we're going to go ahead and apply BPAP to a patient. So we're going to go ahead and turn our ventilator on like we always would. We're going to silence a couple of alarms like we always would. And we're going to choose a new patient using our toggle switch. So we choose new patient. We don't care about their ID. We do care about their size. Know that you could use BPAP or CPAP plus pressure support in a neonate, pediatric, or an adult patient. For the example, we're going to choose an adult patient. Also know that when I provide BPAP or CPAP plus pressure support, I can always use a high pressure oxygen tubing system or supply if I like. I can also use the low pressure system if I wish to do that instead. If I choose to use the low pressure system, it's going to entrain atmospheric air to run my turbine, which may be helpful in some cases. However, I'm still going to have to use a non-vented mask in both modes of non-invasive positive pressure ventilation. So, alright, so we chose to use an adult patient, so we're going to go ahead and select that. We don't want to choose intubated, we instead want to choose non-invasive positive pressure ventilation, so we're going to hit that. I'm going to say that when we show up, that our patient is on a BPAP of 12/4. So I'm going to go ahead and choose my IPAP, and I'm going to adjust it to 12. You'll notice that the pressure support is at 6, and that's because your IPAP, your inspiratory positive airway pressure, is always your pressure support plus your PEEP. So 6 and 6 equals 12. So I'm going to go ahead and select that. Next thing I want to do is adjust my EPAP, and for the case scenario we determined that our EPAP was at 4, so I'm going to go ahead and select that, and I'm going to adjust that down to 4. 8 plus 4 is 12. That's my IPAP. My EPAP currently is 4. I'm going to select that. I'm going to go ahead and rotate it. Remember that BiPAP or BPAP actually does change the mechanics of ventilation, and it does provide ventilatory effort. So this is the rate that I'm providing, and so by selecting this I can choose 12, 14, 16, 18, whatever the patient is on. Again, for this case I'm going to say that the patient has a ventilatory rate of 12 breaths per minute, and so we're going to stick it right there. So boom. And then I'm going to rotate it, and I'm going to ventilate my patient. So what I have right now, allow me to silence some alarms so I can monitor my patient appropriately. So I'm going to silence my low peak pressure alarm and my low minute ventilation alarm and dash those out. So what I have currently is I've got somebody on a non-invasive mode of positive pressure ventilation. You can see that I don't have any spontaneous respiratory effort right now. I've got him on an AC mode with a pressure mode of ventilation right there. I've got them on a rate of 12, an I time of 1. My pressure control is 8. My my IPAP is 8 plus 4 is 12, and my EPAP is 4 right there. Okay, so a couple of things that you want to note right now. So first of all, the flow termination of BPAP is usually 40%. That's standard. The REVEL defaults to 25%, so I need to terminate my flow at a higher percentage. So to do that, I'm going to go ahead and hit the select button and push it in until I get the advanced menu. You guys remember this advanced menu from other videos that we've done. I've got a number of different things that I can choose from, and the one that I want is vent control. So I'm going to go ahead and scroll until I get vent control. I'm going to select that. In this setting I can adjust my rise time, my flow termination, my time termination, my PC flow termination, and my bias flow, my leak compensation, my pressure trigger, and a number of other different things. Just so you guys know that if my patient's moving around a lot and they have a lot of leaks associated with it, I might increase my bias time also, or my bias flow, excuse me. But for this one, let's go ahead and adjust our flow termination. So I'm going to select that. You'll see that I defaulted to 25%, and I want to increase that to 40. Okay. The other thing that I want to do is I want to know what my time termination is. The REVEL will default to 2 seconds, and that's probably not what I want. I want to match it up to the I time that I have. A normal I time will be for a BPAP will be anywhere between 0.8 and 1. So I want to go ahead and go under vent control again, select it, and now what I want to do is adjust my time termination, and I don't want it any greater than my I time, and I certainly don't want it to terminate any less than my I time. So I'm going to match it up to 1 second right there. Again, if you're having problems with leak at this point, then you could always adjust your bias flow. So currently, let's go under vent control again, and we're going to go under bias flow here, and my bias flow is at 5, and maybe I'll give them a bias flow of 10 to allow that extra flow within the ventilator circuit, especially on expiration or during it. One other thing concerning BPAP is that anytime I adjust my IPAP, so if my IPAP goes up right now, so now I'm at 16/4, I should always adjust my pressure control to match my pressure support. So I should allow them for 12, of pressure support also. So now I'm at 16/4 with a pressure control of 12. These two numbers should always be the same. Again, thank you very much for listening to this video. If you have any questions, comments, or concerns, feel free to contact me. If you would like further education on non-invasive modes of ventilation, please see the vent lecture on the AirLink 2/Lifeline1 YouTube page. You can also look up the REVEL CareFusion ventilator manual. It's going to be on page 12-4, and that'll assist you with non-invasive modes of ventilation.